All right, here's the skin model. First we have the epidermis on top, then we have the dermis and the hypodermis with the adipose tissue. We also have a sebaceous gland here in blue with the erector pili as well down here. And then this is a sweat gland just for reference.
So this is the compact bone model. We're going to be first looking at the osteon, which is going to be the circular structure. We have multiple of them. Next, we're going to have the lamellae, kind of like the layers on like a cake, lamellae. And if you look, this does look like a cake, and it's also lamellae. We're also going to have the collagen fibers, which are going to be running perpendicular to each other. So you can see they're kind of crossing each other on the lamellae. Next, we are going to have the lacuna. The lacuna are going to be these spaces, kind of like a lake, between the lamellae and the osteons. Then we're going to have the osteocytes. These are going to be these kind of tick-looking body things. It's just going to be the body of it, which fills in the lacuna, and that's going to be branching off of those as like the legs of the tick are going to be the caniliculi. In the center of an osteon, we're going to have the haversian canal, or also known as the central canal. And then on the outside of this bone, we're going to have the periosteum, and then on the inside, we're going to have the endosteum. On the inside is going to be made of spongy bone, and on the outside is going to be compact bone. Additionally, on the outside, we're going to have the nutrient foramen, where blood vessels are going to supply the bone with nutrients.
Here we have the sternum in its entirety. More specifically, we have the body of the sternum here, the xiphoid process coming off the bottom, and then we have our manubrium, which can also be shown here with our jugular notch and our two clavicular notches laterally. Here we have the clavicle, and all you need to know on it is that this is the medial end and this is the lateral end, and you can remember that because it's lateral versus the medial end, where it articulates with the manubrium, is a lot fuller. So lateral, and then the medial end.
So now we have a scapula. And first we're going to start off with that glenoid cavity. And this is where the scapula articulates with the proximal end of the humerus. Next we have the scapular spine. And then above that scapular spine, we have the supraspinous fossa. And then below it, we have the infraspinous fossa. And then on the anterior side, we have the subscapular fossa. We also have the acromion process right here, and the coracoid process right here. And then we have the medial, lateral, and superior border of the scapula.
All right, this is a humerus. This is going to be a left humerus. So we can see we're going to have the head of the humerus up top, where it articulates with the scapula. Then we're going to see we have the anatomical neck running right where my pointer is, and then below that is going to be the surgical neck. We're going to have the lesser tubercle, which is going to be more medial, and then we're going to have the greater tubercle, which is going to be more on the lateral aspect of the humerus. In between these tubercles is going to be the intertubercular groove, inter meaning between. We move down more distal, we're going to see the deltoid tuberosity, and that's where the deltoid muscle inserts. On the distal end of the humerus, we're going to have the medial epicondyle and the lateral epicondyle. On these condyles, we're going to have the trochlea, and then we're going to have the capitulum, which is going to be more prominent on the anterior side. This fossa where my pointer is at is going to be the coronoid fossa, and on the posterior aspect, we're going to have the olecranon fossa. Here you go.
Here we have an ulna, and we have to remember that the ulna sits near our pinky, so we say pinky ulna. First, we have the head of the ulna, and the ulna is unique in that the head is actually distal compared to proximal. Then on the proximal end, we have the olecranon process, which fits into that olecranon fossa of the humerus. And then we have the coronoid process, which fits into the coronoid fossa of the humerus. And we remember the difference between the coronoid and the coracoid, because if we go up and kind of dab, our coronoid process touches our nose and our coronoid process of our mandible, which you'll get to later. Additionally, we have our trochlear or semilunar notch and our radial notch of the ulna. So that's an important thing. It's the radial notch of the ulna. And then our styloid process.
Okay, here we have a radius. So first we have the head of the radius, the neck of the radius, the radial tuberosity right here, and then we have the styloid process of the radius and the ulnar notch of the radius.
So here we have a right hand in anatomical position, and we're gonna go through the carpals first. So I like to use the acronym Some Lovers Try Positions That They Can't Handle. So first we have our scaphoid, and it comes from the Latin word for boat, which is scaph. So it looks like a little boat, very cute. And then we have our lunate, which looks like a little crescent moon. So lunate. And then we have our triquetrum, and it's also the tri from the acronym. So some lovers try, triquetrum. That's how you can remember that one. And then our pisiform is this little one. And then we have our trapezium right next to the thumb. And we can remember trapezium because your thumb is like a trapeze artist, moving around. And then we have our trapezoid, just like the shape. Then we have our capitate, and it's like a capital letter. It's a very prominent carpal. And then we have our hamate, which looks like a little hammer, or like it has a little handle. And I'd also just like to note that this is anatomical position, and sometimes they could flip, and you have to remember that medial is still towards the pinky. Moving on, we have our metacarpals here. And we remember that there are carpals in the hand because you drive a car with your hands. And then we have our proximal, middle, and distal phalanx of each digit, of the first digit, second digit, third, fourth, and fifth. But also note that your thumb, or the first digit, only has a proximal and a distal phalanx, no middle phalanx.
This is going to be an os coxa. It is going to be a right os coxa. As you can see, this is the acetabulum, which the head of the femur sits in, is going to be pointing laterally. The os coxa is composed of 3 different bones that are all conjoined here in the acetabulum. Those 3 bones consist of the ilium, which is this paddle part, the ischium on the back side, and then the pubis, which is towards your pubic area. On the ilium, we're going to have the iliac crest, the iliac fossa, the anterior superior iliac spine, and the anterior inferior iliac spine. We're also going to have the auricular surface of the sacroiliac joint, and that is where the sacrum and the os coxa are fused. As we can see in the pelvic girdle model, that will be right here. Moving down to the ischium, we can see we're going to greater sciatic notch, and then we're going to ischial spine, ischial tuberosity, and then on the pubis bone, we are going to have the pubic symphysis, which is going to be this pad of cartilage, which is going to conjoin the 2 pubis bones. And lastly, we're going to have the obturator foramen, which is going to be this large hole right here. An easy way to remember it is if you put it up to your mouth, like you're talking to obturator, hello obturator. This is the sacrum. So you can see, we look on the posterior side, we're gonna have the sacral canal. It's gonna run down through here. And then where it ends is gonna be called the sacral hiatus. The holes here, which my pointer is going through, are gonna be the sacral foramina, plural foramina. And then we're gonna have the median sacral crest. Just like on the os coxa, we're gonna have the auricular surface of the sacroiliac joint. Look at these two sacrums. We can see that the one on the right, which my pointer is pointing at, is gonna have 4 foramina and 5 fused vertebrae. However, the one on the left is gonna have 5 foramina and 6 fused vertebrae. The reason for that is because L5 right here has been sacralized to the sacrum, meaning it has been fused with the 5 vertebrae of the sacrum.
Here we have a femur. So starting off, here's the head of the femur, the neck of the femur, and the fovea capitis. Right there, awesome. Then turning to the posterior side of the femur, we have the greater trochanter, the lesser trochanter, the gluteal tuberosity, linea aspera. We also have the adductor tubercle, right here, the rough part. Then we have the medial epicondyle, the lateral epicondyle, the medial condyle, the lateral condyle, and the intercondylar fossa right between. Here is a patella. So first we have the apex, which comes to a point. Then we have the base, which is the flatter side. And then on the posterior surface of the patella, we have the articular surfaces. And it's smooth because it articulates when you move your leg.
Here we have a tibia. Starting at the proximal region of our tibia, we have our medial condyle, our lateral condyle, and our intercondylar eminence, which is like this little mountain. Then we have our medial malleolus, which is like that inner part of your ankle that you feel on that medial aspect. Then we have our tibial tuberosity, that rough patch, and then our anterior margin or crest, which is like your shin. Also, we have your fibula, so remember tibia, fibula, and the fibula is lateral because it has that L. So, first we have our head on that proximal end, and then our distal end, we have the lateral malleolus, which is the lateral aspect of your ankle.
This is going to be the right foot, and we are going to be looking at the tarsals, the metatarsals, and the phalanges. We'll start with the tarsals. An easy way to remember the tarsals is tarsals as in toe, or you walk on tar. So starting off, we'll look at the very back of it. This is going to be called the calcaneus. It's like a potato looking bone, and this is also like where your heel is. Moving up, we're going to have the talus. The talus is what articulates with the tibia, and easy way to remember that is talus starts with a T and tibia also starts with a T. Moving down, we can see this is going to be the cuboid bone. Easy way to remember that is a cuboid bone looks like a cube. It's shaped like a cube. If we move medially, we can see we're going to have the navicular, and that's where my pointer is at. And the navicular navigates these 3 cuneiform bones. Now, starting off on the medial side, we're going to have the medial cuneiform, the middle or intermediate cuneiform, and the lateral cuneiform. We keep moving down, we're going to have the metatarsals. And the metatarsals are going to be these 5 bones. We're gonna have the metatarsal 1, metatarsal 2, metatarsal 3, 4, and 5. If we look at the phalanges, which is gonna be out here, we're going to have proximal phalanx, middle phalanx, and a distal phalanx, and that is gonna be for all the 2nd, 3rd, 4th, and 5th digits. However, the big toe is only gonna have proximal phalanx and a distal phalanx.